With the global population on the rise, many countries are concerned for many reasons. They're concerned because they don't know how they're going to support everyone's appetite, and they don't know how many people the earth can even sustain. GMOs have been helpful because they have given there's enough food for everyone because of GMOs, and so it's been helpful in that sense. But there are negative, especially environmental impacts of the human population on the rise, including deforestation, increased pollution, of course, due to more human activity, even light pollution that isn't maybe as common, abuse of natural resources, overfishing, and many, many other factors that overall contribute to a less healthy environment for the earth. And some countries, especially China, have taken notice of these concerns, and they've enforced their one-child policy. But other countries, like Japan, are still encouraging families to have more kids if they want to. Most of the population growth is seen more commonly in the more poor, rural areas, especially, which is due to many factors, but especially because that people who live in these more in the country, in these rural areas, are less likely to have access to higher paying jobs, career advancement, which often comes by getting a higher education. So many of these countries continue to do their, historic family traditions and businesses, which may not always be very sustainable financially. The population growth topic itself can sometimes be a little bit controversial because people don't really always agree on the best way to control a population and what is seen as the best for everyone around the world. As the populations historically started to branch out, many people began to immigrate to different countries, and this has had many different effects. Of course, the more people traveling in different areas, the more germs spread and diseases. With COVID going on, we can all relate to that. Those who are low income, and especially those who also live in the rural areas, are more at risk for getting diseases that the people who live in higher income areas aren't as susceptible to. For example, chloria, which is a deadly disease, can be often easily cured by antibiotics, but sometimes antibiotics can be expensive, especially if people aren't insured, and so many people won't be able to have access to them. Also, crowding and poor sanitation can also increase the spread of diseases. Even though the U.S. spends the most on healthcare, we still aren't ranked number one on the life expectancy. And I think that might be because we don't focus much on preventative care, which could possibly solve a lot of the health problems that we're facing here in America, including obesity, which is something that we're ranked number one for, I believe.